GP commissioning needs to create multidisciplinary collaboration throughout the whole system. Collaboration is the antidote to silo operating that leads to inefficient, fragmented care. Since autumn 2009, the Southall Initiative has piloted 5 mechanisms that empower people from different parts of the system to collaborate. 1. The backbone of the intervention is an annual cycle of collective reflection and coordinated action. People know long in advance when and how to take part. 3 times a year, broad groups of stakeholders critique progress. 2. Inter-organizational leadership teams facilitate learning and change across boundaries. We invest resources in those who are prepared to climb out of their silos to work with others. 3. Passing the baton from one year to the next in 4 main areas: mental health, acute care, social care, community care. Making sure that each area progresses every year, some moving faster than others. 4. A multidisciplinary team from one general practice in a geographic cluster helps all to synchronize their efforts. 5. Easily accessible data compares progress of practices, clusters, and whole systems. Already, the 5 mechanisms show signs of empowering practitioners and managers from different disciplines and organizations to work together to improve healthcare. Events are well evaluated and attendance continues to be multidisciplinary. The 26 Southall practices have formed into 4 clusters, each collaborating with other organisations for service improvement projects. In 2011, the 4 local projects have evolved into Ealing-wide initiatives. Redesign of mental health services to support shared care across Ealing. A network of 14 practices engaged in the Year of Care initiative. Pan-Ealing intervention to improve care for people with dementia. Local authority-led initiative to improve health through schools. Multidisciplinary facilitation teams hold meetings for practice staff in their cluster to consider the implications of data. We have devised a way to display real-time data of performance. For example, this graph shows reduction in hospital bed use by Southall diabetic patients during the time of the initiative. Even more good news. Participants find the process energizing.
Welcome everybody to what was thought to be the halfway stage of the Southall Initiative for Integrated Care. 4 very modest local projects have escalated to capture the imagination of people throughout Ealing.
We've also heard that the Southall Initiative efforts have been, quote, crucial and, quote, relevant. That has come through in every single survey I actually heard.
What would help more than anything is services or friends, I think it was called, alongside disentangling the needs of patients. And by that, when we refer to children and families, I suppose it's all those other issues that come along with children.
So what we want to do for the next year is to roll this out to the whole borough. Yeah? If it's working in Southall, it's got to be good for the whole borough.
We need more links, more communication with others.
Well, one of my colleagues said, Dr. Pal from Jubilee Gardens, where I am the link worker, and what we found from there that over the time that the referrals have increased, and any GP surgeries where there have been link workers, we've noticed that change has been forthcoming from there as well.
The only way we can work efficiently is to know all the community services and to access them according to our patient needs. And I think Southall Initiative has worked to a great extent to help us to do that.
Only the 9% of the referral come from the healthcare professional. So it means, we have to increase the awareness as well as streamlined approach in referring the patients to the services.
An integrated approach where people are speaking to other people, where people know other people, where people are making links between departments, links between skills, links between the resources.
We certainly talk about it in the office, so whoever comes feeds back to everybody else. And I think that's what the initiative does. It generates communications, it shares knowledge.
I have seen a massive change which was initiated by this by this initiative. It started small and it grew, I think, to pretty much the rest of Southall.
I've never had so much access and opportunity to talk across primary care and secondary care about mental health services, and I just find that just the most exciting thing that's happened in my professional life.
It's not revolutionary, but yet it is, because if enough people take this on and if it is institutionalised, that will be incredible for our healthcare services.
The Southall Initiative provides a way for people to step out of the chaos of everyday life and work together for the common good.